Now the danger of a raised blood pressure is this. A raised blood pressure encourages atheroma. That is the major disease which obstructs blood vessels. And if you have a raised blood pressure inside your arterial system, you are more likely than not to damage the fine mosaic endothelial lining, and deposits of fat and platelet will begin to accumulate and aggregate there, and you end up with atheroma. I say that to you now because I used the term earlier on, atherosclerosis, but it is the atheroma in the lumen that is the most important thing. So that patients who are hypertensive have more coronary artery disease, more peripheral artery disease, more cerebral artery disease, because they're hypertensive. If you have a raised blood pressure, that puts an extra strain, an added strain on the left side of the heart, and you may develop heart failure, left heart failure, or if you're an elderly patient, that may be enough to tip you into left heart failure. And you recall I talked to you about that when I was talking to you about left heart failure last time, but it's exactly the same this time. Blood vessels or arteries in which the pressure is raised may just swell and rupture and burst. If these blood vessels swell and rupture and burst as they do in your coronary arteries, for example, the anterior descending branches of the left coronary artery at the front of the heart, or the circumflex branches of the left coronary artery at the back of the heart, you will end up with a coronary thrombosis, an infarct, or what we call a heart attack. And if these blood vessels swell and rupture and burst as they are particularly likely to do so in your brain, in the circular villus, you will end up with an accident, a cerebral vascular accident, or what we call a stroke. So there are three very good reasons, therefore, to detect patients that are hypertensive, to prevent them developing further coronary artery disease, peripheral artery disease, cerebral artery disease. Many patients, millions of you who are hypertensive, are symptomless. You have no symptoms. You're not aware of it. You're not concerned by it. You not even know that you have it. And therefore, it is very important to detect these patients. And you know there are multiple surveys that go on. And of course, your chances of being picked up is greater if you attend a medical examination for joining the army, the navy, for employment, for retirement, or if you were to visit the dentist. I routinely measure the blood pressure of all my patients, and I pick them up by the week. And I have already told you about the danger of death from renal failure with patients with malignant hypertension if they're left untreated.